Hello and welcome to my channel. In this lecture, we'll continue our talk about the cardiovascular system. So let's begin. We discussed the arteries before, and today we'll talk about veins. They are vessels that carry blood towards the heart after collecting the waste products from the cells, CO2 and the waste products. And so they carry deoxygenated blood from the tissues. Exceptions are the pulmonary and umbilical veins, which carry oxygenated blood. The pulmonary vein towards the left atrium of the heart and to be distributed to the tissues of the body, and the umbilical veins to the fetus. Veins are less muscular than the arteries and are often closer to the skin, and there are valves in most of veins to prevent the backflow. This is a picture of the fetal circulation. This is the placenta, and this is the umbilical vein returning oxygenated blood to the fetus. And you all know about the modifications in the fetal circulation, the shunt present in the liver, for example, and in the atria and between the pulmonary artery and the aorta. Structure of the vein. Veins are classified in different ways. For example, superficial and deep veins, or pulmonary and systemic circulations, and pulmonary and systemic veins, and large and small veins. Superficial veins, from the name, they are closer to the surface of the body and have no corresponding arteries. Deep veins, deeper in the body and have corresponding arteries. Usually they are in the form of venae comitantes. Perforator veins, they drain from the superficial to the deep veins. They are usually referred to in the lower limbs and the feet. Communicating veins directly connect superficial veins to deep veins. Pulmonary veins, they are four veins, deliver oxygenated blood from the lungs to the heart. And systemic veins drain the tissues of the body and deliver deoxygenated blood to the heart. They have valves, as mentioned before, to prevent backflow. This is a picture of a valve. See how it bulges, makes a bulge on the wall of the vein, and the cusps of the valve are well evident to ensure direction of flow of blood in one direction. Veins are translucent, so the color of the vein appears on the exterior, determined in large part by the color of venous blood inside it, usually dark red because of its deoxygenated blood, and veins appear blue because of the low oxygen level in the vein. This may vary from person to person according to amount of oxygen being carried in the blood and how big and deep the vessels are. When a vein is drained of blood and removed from an organism, it appears gray white. The venous system branches, of course, the biggest vein here, the inferior vena cava, which drains into the right atrium of the heart. The largest veins are the venae cava, the superior and inferior vena cava. The superior vena cava carries blood from the upper part of the body, from the arms and the head, to the right atrium, while the inferior vena cava carries blood from the rest of the body below the heart to the right atrium of the heart. The inferior vena cava is retroperitoneal and runs to the right, slightly to the right, after being behind the liver to receive the hepatic veins, and it's roughly parallel to the abdominal aorta along the spine, draining large veins into them as they go up. Here you can see the renal veins, for example. By the way, the inferior vena cava is formed by the union of the right and left common iliac veins approximately at the level of L5. The pulmonary veins, one of the exception veins that carry oxygenated blood from the lungs, after being oxygenated, they deliver it back to the heart. The portal venous system, we talked about that before. The portal circulation is a communication between two capillary beds. The portal system examples are the hepatic portal vein. This is the hepatic portal vein formed by the union of the splenic and the superior mesenteric vein, as you can see here, draining all the GIT to the liver sinusoids to be acted upon. And the hypophyseal portal system, which is a portal circulation where passage of hormones occur. The peripheral veins carry blood from the limbs and hands and feet. About the structure, the microanatomy, veins have a thick outer layer called the tunica adventitia. The middle layer is the tunica media, and it's much thinner than those of the arteries, as veins do not function primarily in a contractile manner and are not subject to high pressures of systole as arteries. The interior is lined with endothelial cells called the tunica intima. So we have the tunica externa or adventitia, tunica media made up of smooth muscles, and tunica intima made up of flat endothelial cells on a basement membrane. The function of the veins, they serve to return blood from organs to the heart. Veins are also called capacitance vessels because most of the blood volume is contained within veins. And in systemic circulation, oxygenated blood is pumped from the left ventricle to the arteries to the body. After taking up the waste from the cells, the carbon dioxide and waste products, it's collected by means of venules and then that merge into veins back to the heart. The deoxygenated blood is taken by veins to the right atrium of the heart, which transfers the blood to the right ventricle, where it's then pumped through the pulmonary circulation to the lungs to be oxygenated and returned back to the heart by means of the pulmonary veins. You can see here the heart pumping through the pulmonary arteries to the lungs, and we mentioned before why the artery is colored blue in this event, because the artery carries deoxygenated blood and it's structured like an artery. On the other hand, the blood is returned back through pulmonary veins to the left atrium. You can see the openings into the left atrium, 2 from each lung, and they're red in this instance because they are structured like veins with thin walls but carry oxygenated blood. Now, because the veins are not resistance vessels, I mean, the smooth muscle layer is thinner than those of the arteries, so it depends on the surrounding pressures to pump blood inside them. For example, there are muscle pump. The surrounding muscles, they aid in the pumping of the blood in the veins. And by the way, the stretching reflex, you feel the need to stretch yourself when there is stagnation of blood inside the vein. So it sends messages to the brain that to contract the surrounding muscles to aid in relief of this stagnation. So you do stretching. There's also the thoracic pump, action during breathing of, especially on inspiration. Standing or sitting for a prolonged period of time can cause low venous return from the venous pooling. This leads to fainting. But fainting usually can occur, but usually baroreceptors within the aortic tissues, we studied this in the head and neck, the baroreceptors and chemoreceptors that detect the pressure and the O2 level in the blood. The baroreceptors in this case initiate a baroreflex to stimulate the release of angiotensin II and norepinephrine, and these, are vasoconstricting agents, stimulate vasoconstriction, and heart rate increases to return blood flow. Neurogenic and hypovolemic shock can also cause fainting. In these cases, the small muscles surrounding the veins become slack, and the veins fill with the majority of the blood in the body, keeping blood away from the brain and causing unconsciousness. Jet pilots, that's why jet pilots wear pressurized suits to help maintain their venous return and blood pressures because they are acted upon about the differences in the G's, means gravities, and this keeps the blood away from their brain. So to prevent fainting and unconsciousness, they wear pressurized suits. Although most veins take blood back to the heart, there is an exception. Portal veins carry blood between capillary beds. Capillary beds are a network of blood vessels that link venules to the arterioles, and capillaries is the site of exchange of materials across the membrane. For example, we have examples of portal veins, like the hepatic portal vein that collects blood from the GIT to the liver, and the liver through the hepatic veins, which are systemic veins. They carry clean blood after being acted upon by the liver, is draining into the inferior vena cava. Blood clotting in the hepatic vein causes portal hypertension, which results in decrease of blood fluid to the liver. Cardiac veins, these vessels remove deoxygenated blood from the heart itself, heart muscle itself. These include the great cardiac vein, the middle cardiac vein, the small cardiac vein, the smallest cardiac vein, and the anterior cardiac veins. Coronary veins also carry deoxygenated blood. They all drain into what's so-called the coronary sinus, which drains into the heart. And the anatomy of the veins of the heart is variable. Usually comprises the following veins that drain into the coronary sinus: the great cardiac vein, the middle cardiac vein, the small cardiac vein, the posterior vein of the left ventricle, and the vein of Marshall, that's the atrial branch of the coronary sinus. Heart veins go directly to the right atrium of the heart. Anterior cardiac veins, and the smallest cardiac veins, called Physician veins, they drain into each chamber of the heart. That's why it's impossible to have a cramp in the heart due to accumulation of lactic acid, because of the extensive venous drainage of the heart itself. Diseases affecting the veins. Venous insufficiency is the most common disorder of the venous system and is usually manifested as spider veins or varicose veins. Treatment can include endovenous ablation, laser energy, stripping, ambulatory phlebectomy, and sclerotherapy. Different types of treatment can be applied to the case of varicosity. Postphobic syndrome is venous insufficiency that develops following deep venous thrombosis. Deep venous thrombosis, or DVT, is a condition in which a blood clot forms in a deep vein. This is usually the veins of the leg, and I showed you before a picture of a leg affected by DVT. Immobility, active cancers, obesity, traumatic damage, and congenital disorders that make clots more likely risk factors for developing of DVT. There is usually swelling of the affected limb with pain of the overlying skin rash. Deep venous thrombosis is dangerous because part of the clot that is clotting the vein may be detached and clogs itself in the lungs, causing pulmonary embolism. Portal hypertension. The portal veins, they are in the abdomen and is associated with cirrhosis or diseases of the liver, or conditions where there is obstructing clot in the liver, like the Budd-Chiari syndrome, or compression from tumors or TB lesions, tuberculosis lesions. And portal hypertension causes ascites and edema of the abdomen, with prominent veins on the skin of the abdomen that drains into the portal circulation, like the veins, the paraumbilical veins, for example. And any veins that drains into the portal circulation are swelled, including those at the lower part of the esophagus, causing the esophageal varices. Other veins or other conditions like thrombophlebitis, inflammatory condition of the veins related to blood clots. Veins of clinical significance, veins called the Batson's plexus. It's the inner vertebral venous plexus, and it's all over the vertebral column and drains from the tissues of connected to the external vertebral venous plexus and to the outside. And the problem here that these are valveless veins, which means that metastases from nearby organs can spread through the vertebral venous plexus or spine metastasis. The great saphenous vein, it's the most important superficial vein of the lower limb. Incompetence of this vein is an important cause of varicose veins of the lower limb. Thebesian veins are the small veins draining the myocardium into each chamber of the heart. The coronary veins are all empty into the coronary sinus, which empties into the right atrium of the heart. The dural venous sinuses within the dura, matter surrounding the brain. They receive blood from the brain and also are a point of entry of cerebrospinal fluid from arachnoid villi absorption. Blood eventually enters the internal jugular vein through the sigmoid sinus mainly. I hope you got the maximum benefit from this lecture, and thank you very much for watching.